And so that being said, now that you kind of understand that concept, let's look at some research studies that have asked this question and looked at this in people who were stressed out. So this particular study is a pretty interesting study, and they've done several of these now. But this was post-earthquake trauma. So these were adults that were experiencing heightened anxiety or stress 2 to 3 months following the earthquake. And so they took these adults and they put them on a couple of different multi-nutrient formulas. These are just trademark names, but they use a formula called Baroka and another one called C&E. And basically what these formulas are is they're mixtures of higher doses of vitamins. So it's basically trying to simply summarize the vitamin complexes. And what they found is that the study supports that micronutrients as an inexpensive and practical treatment for acute stress following natural disaster, with a slight advantage to higher doses. So more was better in this particular case. And you can see all treatment groups experienced significant declines in psychological symptoms. But the group given the supplements experienced greater reduction in intrusive thoughts as compared with groups not given the intervention. And then we have another study where you can see psychological functioning 1 year after a brief intervention using micronutrients to treat stress and anxiety related to, again, an earthquake. So these are earthquake studies. And what they found here is treated participants had better long-term outcomes on most measures compared with controls. Those who stayed on micronutrients through to follow-up or stopped all treatment reported better psychological functioning than those who switched to other treatments, including medications. So the ones that stayed on the multivitamin, multimineral did better, right? About 10% of the sample continued to have post-traumatic stress disorder symptoms, so there were some that it didn't help, but a majority of these individuals were helped, again, by simple supplementation. So in this case, it was an external stress. An earthquake is more of a traumatic stress and fear that is created, but in these trials, you know, in some cases a month out, in some cases a year out, multi-nutrients, multivitamin and minerals were found to be helpful and improved outcomes for these patients. In essence,